Hello, everyone. This is Dr. Michael Hirsch, the Medical Director for the Division of Public Health and Chief Information Officer for the City of Worcester during these pandemic times. So I'm glad to get another chance to speak to you today. Last time we talked a lot about where we've been with the COVID virus. I will give you a brief update today, but I really want to talk more about vaccinations today because there's so much misinformation about vaccinations out there. I wanted you to get what I would call the straight story on that. So as far as COVID goes, I think overall our community is showing signs of good recovery from the deepest, darkest days of the surge, which were in April, May, and June. However, our numbers for the last few weeks had trended up, and Massachusetts, which has very strict criteria for grading community spread, put us back into the red zone. So that prompted the city manager and the mayor and I to do another live press conference like we were doing daily for all those weeks. And we decided to just let the people know our contact tracing and the investigations we're doing as to why our numbers were going up really point not to senior citizens for sure. It's mostly the young people that are coming back to Worcester from college, the young people that are hanging out in restaurants and lingering too long, the people that are having backyard barbecues and house parties to watch the Cam Newton Patriots. These are the events that we know are starting to cause clusters to reappear. And we don't want to see that to continue. So we kind of sounded the alarm, and I'm hoping that people are taking it seriously. We had some lower numbers over the weekend, but it's going to take a 2 or 3 week period of the Mass Department of Public Health to reevaluate us, to give us a better grade than red. We want to get back at least to the yellow, if not into the green. Meanwhile, there's stuff that we can do to help solve some of the medical issues that would come if we really have a big outbreak of COVID. And that really revolves around vaccinations. So first, I want to tell you a little bit about what vaccinations are. And the two big vaccinations that I'm going to be promoting today are the flu vaccine, which is here and now and ready to go. And then, of course, the COVID-19 vaccine, which is in the final stages of what are called stage 3 trials. And that will make it likely that that this COVID vaccine will become widely available early in 2021. So let's go back a little bit on vaccinations. The person, if you ever get asked on a trivia quiz or if you appear on Jeopardy, that who's the person that mostly gets credit for vaccinations in Western medicine, it was a Dr. Edward Jenner. He was a British physician. In 1796, he took a young boy who was suffering from the early stages of smallpox, and he inoculated that boy with a scratch from a pustule that a cow had. Cows didn't get smallpox, cows got cowpox. But there was enough similarity in the viruses that caused both of those diseases that it was possible to get immunity from that kind of inoculation. And when Edward Jenner was successful in saving that boy, he started a program of inoculation where this scratching with the cowpox evolved into actually scratching with smallpox debris in patients that had smallpox, and vaccination became a thing. So vaccinations have been very important in eradicating a lot of diseases that now we don't even think about as a big issue, but back in the early part of the 20th century, were quite deadly. Measles, mumps, rubella, all of those childhood diseases had a pretty significant fatality rate for children. Rubella had effects on pregnant moms that led them to have very bad pregnancies and children with congenital malformations, birth defects. Then, of course, you know the story of Dr. Jonas Salk, who was New York City born but had gone to Pittsburgh and started to try to come up with a solution for the deadly polio infection. Polio was something that almost every summertime in the 1920s and 30s took the lives of many, many people and left many of them handicapped. The most famous person was Franklin Delano Roosevelt, our four-term president who got us through the Depression and World War II. He was a polio victim, and he made a remarkable compensation for it with the braces that he wore, and many, many people never even knew that he was afflicted by this. But every summer there was a sense of dread that this virus was going to get us. And Jonas Salk, and then later another virologist named Louis Sabine, came up with a vaccine to eradicate it. So let's talk about the flu. The flu has been a little bit trickier because the flu every year presents with different strains taking predominance. And the flu vaccine, therefore, has had to have a group of scientists across the nation agree on betting on which of the strains are going to be prominent this year. Sometimes the scientists guess dead right and we have very effective vaccinations. But sometimes the scientists guess wrong, and in those years, the flu can still be quite prevalent in the population. And you know what the flu is like. It's watery eyes, it's runny noses, it's cough, it's fever, it's achy bodies. It's a miserable feeling. We have always encouraged the flu vaccine here in Worcester from the days when Dr. Arnold Gurwitz and Dr. Leonard Morse ran the Department of Public Health. There's been an effort called community immunity where we've tried to spread widely flu vaccine to especially seniors, but also to young children in school to prevent absenteeism and to enable the school year to be productive. So this year is no exception, but it's even more important this year to get the flu vaccine. Now, there are a couple of different types of flu vaccine that you may have had experience with. One is called an inactive vaccine, meaning they take parts of the flu virus, but they're all deactivated, they're dead, and they inject it as part of the vaccination process, and your body then starts to rev up and make antibodies to the flu particles that were injected. And it takes about 2 weeks for you to get immunity from that. And as I mentioned, it's not that the flu vaccine doesn't work. It's just that if they have guessed wrong and the strain of flu that's coming down the pike for 2021 is not one of the three, they almost always pick three different strains that they're going to attack. That's why sometimes you might hear the word trivalent. It's three different types of flu that they are building up against. If they guess right, you probably won't have the flu. If they guess wrong, you can get the flu, but usually the level of illness that you reach is much, much less. You don't have quite the shaking chills and the terrible nausea and all the other kind of side effects that the flu can cause. So it's still worth getting the flu shot.
How long have you been feeling like
The
this?
other kind of flu vaccine that you get is not a shot, but it's a nasal spray. And this one is actually active virus, but it's not the exact flu virus. It's a cousin of the flu virus that has enough shared properties that the body will make antibodies that will affect both the real flu and this kind of imposter flu that they're injecting into your nose. So that one is called a live virus vaccine. And it's only to be used in people between the ages of 5 and 50. Generally, seniors shouldn't get the live version. Pregnant moms or anyone with an immune problem shouldn't get the live version, and little kids shouldn't get the live version. So it hasn't been that much in favor over the years now, and most people that get a flu vaccine will get a shot in their arm. Now, the flu vaccine is important this year because what we have been dreading is what has been termed the twindemic. And you may have been hearing about this or reading about this in the newspaper. What is a twindemic? The twindemic means that just when the flu season is starting to peak, and that won't be until probably November into December into January, in those late fall, early winter months, that's when we expect the COVID-19 second wave to come. With all the stuff you've been hearing about COVID, and some people have wondered, have we already seen a second wave, and what we're talking about in the winter is a third wave? I think most of the NIH and CDC scientists think that what we've been seeing as quote-unquote surges all through the South and the Southwest and the Midwest are not really surges from the second wave. It's still the first wave never was knocked down because those states decided, unlike the New England states, to open up very fast. They didn't respect the virus, and the virus kicked them bad. So we expect this second wave here in New England to hit in that same period when the flu virus is going to come. So imagine we're in a situation, I hope it's not going to be as bad as it was in April and May, when we didn't have enough beds, everybody was running around looking for the personal protective equipment, there weren't enough ventilators, all of those kind of issues. Plus, you have this wave of people coming in, coughing with a fever, achy all over. It could be either the flu or it could be the COVID-19 virus, and you've got to have a lot of time to sort out which is which. By then, we might have more rapid COVID tests. We also have a rapid flu test, but it's going to clog up the emergency rooms, and it's going to also involve a lot of younger kids. And we had plenty of surge capacity when we had adults getting hit by COVID and not so many kids. But the flu hits the kids, and there's not a lot of surge capacity in central Massachusetts for kids. UMass is the only facility that has an inpatient pediatric unit. It has an ICU of 10 beds, and it has a floor unit of 30 beds, and that's what we have. So we would have to make a major reallocation of beds and get a lot more practitioners used to taking care of kids into town in order to really get a big surge if we had kids involved. So that's why we're so eager to have seniors like you get the flu vaccine this year. At best, Worcester in the past has only been successful in vaccinating at most about 35% of the population. That's a very bad track record. And in the schools where we have all of these special programs to vaccinate the kids, our graduate nursing students at the UMass Medical School teach the first and second year medical students how to administer vaccine, and they come and they do a program that Dr. Maddie Castile, our Commissioner of Health and Human Services, has helped to arrange so we can make sure no child is left behind. And even in that circumstance, we have only scratched the surface of about 55% of the school kids getting vaccinated. Now this year, Governor Baker has mandated that any child that is going to school in the public school system has to be vaccinated. Otherwise, they have to be homeschooled. And so that's been controversial. Many people are complaining and counter-protesting that it's my child and my choice. But, you know, this is the reality, and I'm just trying to be straight with you guys. Your individual health choices no longer just affect you. The individual choices you make affect everyone in the region. And we have to recognize this as a big, big problem. And that's why I think that you have to kind of look to a bigger place for making your protests. You're not going to win any friends amongst the public health community saying that I don't feel like my child should have a vaccine, because the fear about vaccines has always been unfounded. It's been based on some debunked British literature about it somehow being related to autism, and that had nothing to do with the flu vaccine. It had everything to do with different kinds of vaccine, like the measles and mumps and diphtheria kind of injections that we were giving. So that being said, let me talk one more time about the COVID-19 vaccine. It's not going to be available probably to the public until at least 2021. There may be a release of some of the vaccine in November, December to first responders, to healthcare providers, to essential workers. And it's going to be a tricky vaccine. It is not like the vaccines I've described for the flu. It's a vaccine that there's several different trials going on, but in general, the vaccine is going to be made of a small particle of what's called DNA or RNA. These are the molecules that the gene produces that make the COVID virus reproduce and do its attack on the cells. But these little pieces of DNA and RNA, if they're injected into our system, we can develop antibodies, these proteins that attack those proteins, and that gives us immunity. The antibody is the messenger of immunity. And there's two different types of immunity. There's what's called humoral immunity, where the antibodies are in your bloodstream, but there are also immune white cells called T cells, and those T cells are killer cells. And so far, it's very encouraging that in the trials that are being done, the T cell numbers in the patients that have gotten these trials have gone way up. So you're getting both kinds of immunity, which gives you the best chance of fighting this off. But as I mentioned, you need not just the first shot, and within a month, you need a second shot. And what we don't know is how long are you going to have immunity? Are you going to need to do like we do with the flu, get a COVID shot every year? We don't know. So what I can tell you is that we are hopeful that if we can do a mass vaccination program here in Worcester, and we're planning for that, believe me, every day there's a meeting about how we're going to take over schools and malls and parking lots and garages for both drive-through kind of vaccination programs and walk-up vaccination programs. And if we can get that done from, say, January until March or April, we will probably have achieved this thing called herd immunity, where 60% of the population is immune to COVID by the summertime. That's when we have the best chance of creating a new normal. It may still involve wearing a mask, but it might not mean that we can't go indoors to have restaurant dinners. It might mean that we can start doing normal school again with kids sitting next to each other. It might mean that we can start planning on going on trips in the airplanes and boats out to Martha's Vineyard, all the things that we've had to avoid because of the close proximity of people, we'll be able to start doing again once we have that herd immunity. But it's not going to happen overnight, and it's not going to happen without tremendous cooperation of you in the public. So we in the public health sphere are working with all our health delivery partners, the two medical systems, the UMass system and the St. Vincent system, the two community health centers, the Edward M. Kennedy Center and the Family Health Center, with Fallon Clinic, with a number of the drugstores, CVS and Walgreens. All of us have been meeting to talk about how can we get the maximum distribution of these vaccines so that we can achieve that herd immunity and get off of this terrible treadmill that we're on now, where it just doesn't seem like we can reach out and touch people and be together with people the way we all had been in 2019. So I'm optimistic. I think that we have the tools to do what we need to do to get there. It's not going to be without bumps. People are going to still come down with COVID. People are still going to come down with flu. People are still, unfortunately, going to pass away. It's a disease that, when it strikes the person with medical comorbidities, or folks older than 65, or folks that have an immune system problem, they're very vulnerable. And I don't see it being just a clear and easy shot to get to where we want to be. But I have every confidence that it's not going to be because of a failure of our health system or our city government or our governor to try to make this as smooth a transition as we can. So I'm very excited about this next year because I want to get out of this hole that we're in so badly. There's so many exciting things happening, as you know, in Worcester. Next year, hopefully, the Woo Sox will be in business over near Kelly's Peanut, I have to call it now. We have so much going for us here in the city, and we were on the cusp before this virus hit of a real renaissance, and I think that that's only going to continue if we do the right things. So when you have friends that are questioning, I don't know if I should get the flu vaccine, I never get the flu, I'm not worried about the flu, please, especially if you're in that high-risk age group, it's very important to get the flu vaccine and then keep your ears and eyes open for the COVID-19 virus vaccine. In the meantime, you may see advertisements that there are trials going on for using plasma from patients who had COVID-19 and survived as an early drug to administer to somebody who starts to get sick from COVID-19. And there's also trials going on of the vaccine itself. And if you feel like you want to participate, that's a wonderful way of showing your community spirit. It actually pays off. These trials that are going on is like $200 a person for signing up, and there's lots of information about it on our www.worcesterma.gov/health website. So I want to thank all of you for listening. I enjoy these sessions. I hope that you do too. If you do or if you don't, give us some feedback so that we know what you want to hear about next time. And until that time, this is Dr. Michael Hirsch from the Worcester Division of Public Health, thanking you all, wishing you a safe fall season. Now we just joined into the fall. And for those of you in the Jewish faith like I am, Shana Tova, meaning Happy New Year. This is a time for renewal. And I think we could use that overall as a country and as a city. So bye-bye and see you next time.